I know this takes a minute. Okay, you guys ready?
Yep, I'm
Hi,
live.
everybody. We are starting our first demo of the day today. Allison here is doing a client microdermabrasion. Microdermabrasion is a physical exfoliation of the skin using fine, tiny crystal and suction to abrase that top skin cell layer. This is a fantastic, no downtime treatment. A lot of times you can do it as quickly as in a lunch. Come in, do it, go back to work, go back home. Obviously, we do remove your makeup prior to this treatment, and then you can see how that tip is basically moving across Lori's face, simultaneously blowing out crystal and sucking that crystal back in as she glides that tip across the surface of her skin. This is not a spa treatment. This is not something that feels that much of relaxation during it. Would you say it feels kind of like what, sandblasting?
Yes. Yes.
Yeah. It feels gritty, okay? You do definitely feel that grit and you feel that suction. You do have some redness that comes up to the surface of the skin when you're performing this treatment. The redness actually really subsides pretty quickly for the most part. Most people don't have redness for any longer than maybe 15, 20 minutes. And like I said earlier, you can put a makeup on immediately after this treatment if you needed to go out, do something, and go about your everyday life. If it's your first microdermabrasion, would you break out or purge or maybe have a slight breakout afterwards? It's highly possible. I cannot stop people from breaking out. But the more often that you do these types of treatments, the better your skin responds and the less likely that you would break out. I always, Alice and I, as far as our physical exfoliations of the skin, we always couple these in with also chemical peels. We always do a light to, most of them are pretty light grade chemical peels. But everybody's skin is a little bit different. This patient in general does have a condition called melasma. And we've worked with her throughout the years doing microdermabrasions, chemical peels, and really kind of, she's going backwards. She's definitely learned how to control her melasma very, very well over the years with kind of just some tips that I've shared along. People with melasma are not good candidates for IPL or laser treatments. So these type of treatments are really the type of treatments that they need to do to control their melasma. And melasma is a hormonal situation in the skin where dark patches come up to the surface and they're very, very hard to get to lighten up and remove. There's products out there, but obviously these types of treatments, along with chemical peels to help that pigment lighten up, are really the best for this type of skin.
Tina, who are good candidates for microdermabrasions?
Everybody's a good candidate for microdermabrasion. The people who have the most cystic acne to the most aged skin are great for microdermabrasion. There is no one too sensitive. I get a lot, this is a great question for the sole fact that I get a lot of this, people who have rosacea, which is a lot of redness in the skin, they've got really sensitive skin, they always think that they're not a good candidate for this treatment. That's not true. It is a good treatment for every single skin type. Now, we can adjust the crystal, we can adjust the suction, how many times do we go around their skin, how aggressive we use the piece of equipment is definitely can vary from patient to patient depending on their sensitivity level, but every single person on the planet is a candidate for microdermabrasion. There is not anyone out there that couldn't do this. As far as the peel goes, now she's going to dust her off and she's going to kind of prep her for a peel. When you do a physical exfoliation and then you combo it in with a chemical peel, the absorption of that chemical peel is greater. So this is where I come into play in choosing the right peel for your skin. There are all kinds of different peels out there on the market. Some are very, very mild, even it's mild for somebody that is with child or pregnant, to really, really deep peels that are gonna, you're gonna shed and peel. Most of the time, Allison and I are not really trying to make your skin fall off. Okay, we're kind of, most of the time, we're trying to give you the best treatment possible with the least amount of downtime. But if you come to me and you've got a lot of problems, sometimes I've got to get to a point where you don't have a reaction, and sometimes that takes months to get there, and then it gets easier and easier throughout the process. This is why the patient preferred program is so great. You come in monthly, you do these types of treatments. We've got the $750 patient preferred program, which is $750 for the whole year. That means 12 treatments. You come in once a month and do microdermabrasions and chemical peels. This treatment itself. That's all that comes with that package. But doing that alone monthly and getting yourself into a regimen and getting yourself into some kind of a skincare kind of almost habit will improve your skin dramatically. That's the first step. And sometimes you need other things than microdermabrasion and chemical peel, and that's what we kind of discuss along the way when you're, in that process and going through that year-long program.
This is a great treatment for someone to get started with that has never done
yes,
treatments on their skin before.
Somebody that has never, somebody that comes in, and I get this a lot, where they come in and they're maybe in their late 40s, early 50s, and they come to me and they start seeing their skin aging, and they're like, okay, I feel like it's time for me to start doing something. It's time for me to try to do whatever I can to kind of slow down the process of aging. This is a fantastic first start. I mean, it's so super easy. And really, to be quite honest, is whatever discomfort that you feel during the microderm process, you start actually kind of getting addicted to the feeling. You really do. You kind of crave it to come up that next month where you're like, okay, I'm ready to get my skin scrubbed again. And so it is a great first step. Absolutely.
So what's happening now?
So Allison is applying a very light peel on her today. Now, in the past, we've done all kinds of peels on this patient. And for the most part, because she has melasma, a lot of times I will focus around peels that lighten that pigmentation. She's got her pigmentation kind of under control, so I don't feel like I need to do that right now. But so we're doing something that's very like glycolic. Glycolic is very anti-aging. It's fantastic for actually hydration to the skin. As much as we exfoliate off, sometimes the skin can get dry, parched, and want to flake. Glycolics usually keep that intact where you don't have a lot of flakiness, and it hydrates, closes the pores. It's a great peel. Where are we at on a scale of 1 to 10?
It's okay, no. I'd say 8.
An 8? Okay, so Lori is, oh my God, Lori, she is.
Okay, all right, so maybe a 5.
Okay, that
was better. It's going down already.
That sounds much more realistic. I always say that to my clients. Where are we at on a scale of 1 to 10? 1 being nothing, 10 being the most excruciating pain you've ever felt.
Well, see,
and
I
8 is 5.
I didn't know 10 was excruciating pain. I've been doing this for so many years. You've never explained it. I'm kidding.
That's okay. That's okay. She does well. We love you.
I'm still laughing.
We love you. Yes. So yes, so that kind of penetrates into the skin. It sits there, and then we usually do something of a mask over top of these peels to kind of shut down the peel. So she'll get to that portion next, and then she really will be out of whatever discomfort that she might be feeling right now. It will really kind of pretty much gradually just shut off.
I do feel like I am not in any discomfort right now.
Perfect.
I am not.
Yeah.
I promise.
It's that first, like, it's that first jolt of it, like, almost absorbing into the skin. You kind of get your, like, brain kind of like, oh my God, is it going to keep getting worse? Is it going to get worse? And it really doesn't. It usually, within a minute or less, it usually kind of really calms down and kind of evens out. You get like a creepy, crawly, burny, itchy kind of sensation when you apply a peel. That is easily neutralized and calmed down. If let's say somebody is at
an 8.
Okay.
We could neutralize a peel very quickly and get them out of that discomfort very, very quick.
So what does the mask do then?
The mask is just an added layer of, first of all, it's going to neutralize it somewhat. It doesn't completely negate the peel itself, but it is going to neutralize it, calm it down. And it's almost like marinating that peel inside the skin surface and then giving it a little extra added. This one is the Vital C mask, so it's just giving it some vitamin C, a little bit of glow, shutting everything down, calming everything down, a little hydration.
This feels great.
Allison's got a fantastic touch.
Yes.
I agree.
She's great when she's doing the massage, but then when she's doing the microderm, you're like, oh my God, you're hurting me.
Nope, never thought that.
It's worth it for that little massage.
Exactly. What I tell you, Amanda,
A demonstration of
they always forgive you
I know.
if you give them a good
massage after. Yeah. Yes. Yes.
Pamper them after the torture,
Right.
and they very quickly forgot
Yes.
that you tortured them.
Right.
I keep coming back.
Yes.
We say it's a do good, not feel good normally.
That's right. It is a do good, not feel good. It's it's a half and half. I
Yes.
feel like a half of this treatment process is a feel good. The other portion is a do good thing.
Doing something.
And that's my motto.
When I first started coming in, my melasma, probably 6-7 years ago.
Yes.
So out of
Intense.
control.
Very intense. I mean,
I couldn't
very,
cover it up
very,
with makeup.
very, very dark patches on her cheeks. And she didn't realize, sun wasn't her friend. She still has sun exposure. She just knows
Sunscreen is
so
my
much
friend.
better on how to protect her skin from the sun now, that she doesn't then have that inflammation and that flaming of that pigment happen as often now that she understands how to treat her skin.
Absolutely, and you guys have done that for me. It's the products that I've used are just amazing.
Yeah, we have a lot of different. We have a plethora of products here in the office. Obviously, we're going to be putting some products on this patient. Obviously, after this treatment, we've got SkinCeuticals. We've got a lot of SkinCeuticals. It's a fantastic product line. I love it. It has everything that you can ask for: cleansers, toners, correctors, sunscreens. It has it all. I don't carry every single last product in SkinCeuticals, but I can get it for you if you need it. So what I do have, I have vitamin C, I have some hyaluronic acids, we have moisturizers, we have sunscreens, toners, which I absolutely love, the SkinCeutical toners, the conditioning solution and the LHA.
And everything is 20% off.
Everything is 20% off. And if you're part of the Patient Preferred program, it's 30% off. So if you need to stock up on products, this is the time to
Triple
do it.
lipids and the stuff.
Yeah, so those higher price, the higher price products like triple lipid and CE ferulic, those are going to be on the higher spectrum of pricing. They're 30% off. It's such a great time to pick those types of products up. If you're waiting for the best time, this is definitely it. We also have the Image sunscreens. I have my pharmaceutical grade TomTom pharmaceutical line, and we also have the definage. So definitely a lot of products to choose from. I feel like that's a big thing with any of my clients that come in for the first time. They don't know what to use, how to use it, what order to use it. This is why the Patient Preferred program is so great, because really I can teach you all of that throughout our relationship and like keep you going. And then when things need to switch up, things need to change, I have a lot of different things that I can recommend for you and switch things up.
And anyone out there watching live can give us a call, purchase those products.
Yes.
You can call to set up a consultation with any of the ladies to get that skincare regimen down.
Yes, absolutely. We are doing all our sales for open house until 2 o'clock on Friday. So if you want to purchase over the phone, just do it before 2 o'clock on Friday.
Phones turn off, 2 o'clock on Friday.
Phones turn off. So,
Ask me what my pain level is now.
what's your pain level now?
It's a 0.
It's a 0.
I recover so quickly.
I know. Well, isn't that amazing? I mean, you do go through different sensations throughout this treatment, but it is so great. Basically, by the time you're leaving, you're not feeling, crazy. You're not feeling like, sometimes people will feel a little bit of tingle, a little bit of spice, but nothing that lasts.
My skin just feels so moisturized and hydrated.
Yes.
It's such an amazing feeling.
My room's here.
Your skin's glowing.
And my makeup will go on better.
Your makeup will go on better. Absolutely. Later on today, we're going to be doing a treatment called dermaplaning. It is also a physical exfoliation of the skin. That one is definitely by far a great one to do prior to an event if you want your makeup to go on better. This one is still wonderful, but that one is, and we'll explain that later when we get to that demo, why that one is a little bit better for makeup application.
Does this help for pore size?
Absolutely. It's going to help clean out the pores, it helps minimize pore size, and it's great for fine lines, wrinkles, overall appearance, textural issues. It's very, very good.
Now, Allison just put on the #1 anti-aging product.
Yes, and it is sunscreen. So I'm sure everybody in the non-skincare realm probably gets so sick of all our skincare technicians telling them to wear sunscreen, but truly, it is the cheapest anti-aging cream out there on the market, and if you're not using it, you're missing the boat. You're great. Okay. All right. Well, we are signing off. We'll catch back up with you guys at the next demo.